You got a better job.
I'm sorry, you all turned it off. At this time, we will have a certification of resolution of compliance.
Madam Chair, I'd like to make a motion. The closed meeting was conducted in conformity with the provisions of Virginia Freedom of Information Act as required by Section 2-2-3712D of the Code of Virginia, and certified that only public business matters lawfully exempt from open meeting requirements were discussed, and only such public business matters as were identified in the motion by which the closed meeting was convened were discussed or considered.
Okay, is there a second?
Second that motion.
Okay, we have a second to the motion. At this time, we will take a vote. Okay. Did this vote come up? No. Okay, the motion passed. We have five yeas. Thank you. The next item on the agenda, we're going into the business section, and tonight our business is Executive Order Number 2. Okay. Everybody ready?
Oh, yeah. we're ready.
Okay, at this time, I hear any discussion?
Yes. Madam Chair, I would like to have some discussion on this. And I think this is very important that we all, share some of our views on this since the public didn't have the opportunity to speak tonight. Overwhelmingly, the emails I received, and I received close to 40, were from parents who want their kids to go to school without wearing the masks. And these were all very well thought out emails. None of them were just, this is what I want, you better do it. And I had some emails from people who wanted the masks to be continued, and they were very thought out emails as well. So we're lucky to have some very articulate people in this county. Now, I did a lot of research at the same time. And in my research, I found that statistically, there's no difference in COVID rates in states that require masks and those that don't. There's a 0.0013% chance a child getting extremely sick from COVID. Our PPE standards are not where they need to be if we were to require them. Most people don't know, but in a hospital setting, and I'm sure my colleague on the right, she definitely knows this, but they're constantly changing their masks, patient after patient, all day. Our kids are using the same mask day in, day out. There's a big impact on our kids. Psychological impact. We've got more kids committing suicide, kids getting sick. Anecdotal evidence that more kids are getting sinus infections and that type of illness. But for me, it comes down to the Constitution. The Virginia Constitution actually states that a law cannot take away the school board's authority. So when we talk about SB 1303, that's taking the school board's authority away. Let's not hide behind that, folks. We are talking tonight about parental choice. We're talking about whether a parent has a right to decide what is in the best interest of his or her child. We don't want somebody to say, I feel uncomfortable, so your child will do this. I think that's wrong. And that's not the America I grew up in. We have personal freedoms. We also have responsibilities. Absent overwhelming evidence that these are protecting us, I will vote in favor of Governor Youngkin's executive order. And I hope the other members will join me. Thank you, Madam Chair.
You're welcome.
There's an old cliche saying, the squeaky wheel always gets the oil. It's only going to take one child to die in our school system. It's only going to take one. And I understand that the executive order the governor has passed, in my opinion, it was done in haste. But what we need to keep in front of us is all of our students in the school. And our board tonight will send a clear and concise message that we are on one accord. And when we vote tonight, you know, it will be done in the best interest of all of the students in the school. Thank you.
So I want to kind of clarify for the only medical professional actually on the board who actually has dealt with COVID since it's been here. Actually, before March, it was here. Having had patients die of COVID, family members just went to a funeral. To what colleagues said, that's actually false. We wear the same mask all day. So we don't change our mask out several times. And yes, different masks have different efficacies. That's true. N95s protect more than these masks that are 3-layered. Yes, that's true. I agree with my colleague over here as far as we have to do what's best for the interest of all children, not a select few, not some. Everybody doesn't know everybody's medical history. You can't walk around and tell somebody, oh yeah, you have an immunocompromised, you're in an immunocompromised state. You have diabetes, you have asthma. Those persons will be at higher risk of being hospitalized than any other population. But tell me where you can see that. Tell me where you can see a child that has diabetes. You can't. And with the high transmission and how contagious this virus is, we need to really be really serious about this. This is not something everybody keeps saying, oh, you just get the flu. Yes, some people may just get flu-like symptoms. Some people may have no symptoms at all. But what about those that die and lose their lives? I'm not willing to risk any child's life or a staff member. We haven't even spoken about the staff. They're risking their lives, the teachers are, the bus drivers are, and yet we want the schools to stay open, but we want to say don't wear a mask. How else are we going to protect? I'd rather, if it's 0.1% protection, I'll take 0.1 protection over 0 protection, hands down. I've dealt with this disease face on, head on. You can't, nobody can tell me, I'm going to go by CDC guidelines, scientists, facts, people that are infectious disease doctors, people that are epidemiologists that deal with pandemics. That's who we really should be getting guidelines from, not people that are not in the medical field who've never dealt with this before. I'm not taking advice from, I don't even know where those statistics came from. If it's not up to date or Dynamed, those that I look at every day when I'm looking at disease processes, not WebMD, not Google University. Google will get you in trouble. Google is not my go-to. That's not what I go to. That's not what I look at. I'm looking at evidence. I'm talking about things that I've experienced myself. Medicine is a practice. You can read all you want to read, but if you're not in there like I'm in there every day, seeing this every day, day in and day out, doing it, your book don't trump my experience. I want what's best for all students to be safe, and that's my stance.
Thank you, Ms. Dow. Mr. Cunningham?
Okay. For me, I'm looking at the numbers and the numbers are going up. The numbers are not going down. We haven't even reached the plateau or the peak of what's going on right now. So I cannot see not wearing masks. I believe in following science. Science says wear your mask. CDC, wear your mask. We have to protect our kids, and that's all our kids. I understand a number of parents have written me, and I got the numbers down here. It wasn't as many as Mr. Collick got, but I think I got about 15 different emails from parents. And it was pretty much split on whether we want our kids to wear the mask or we don't want our kids to wear the mask. I mean, I think it was one that said, one over, because it was 15, said, you know, y'all got to make this decision. And that person said, I'm glad I'm not in your shoes. The issue, like I said, and like Mrs. Dial said, we're responsible for all the kids. I understand parents don't want their kids, some of the parents don't want their kids to wear the mask, but then what about the parents who do want their kids to wear the mask? Then we also got to look at the teachers. I mean, teachers want the students to wear masks. Because a lot of people have elderly parents. They take COVID home to the parents, and I mean, even if you've gotten the shot, the vaccine, you can still catch it. So why would we take the mask away? I mean, I don't care if it is 1% protection. 1% is better than 0%. I think Ms. Dial said that. So we discussed it with our attorney. Legally, this is probably going to go to court. So, you know, we've got to make a decision, and our decision, it's not a personal decision. It is a decision for the staff and the students, mainly the students. So, I mean, for now, we're going to make the decision. We're going to vote. But we need, I know some of you are not going to be happy, but we still need your support. I've seen emails saying, my kids are coming to school on Monday with no mask, and we'll have the executive order in your backpack. I mean, we're going to have to deal with that, and we will. I prefer for us to work together. This is not political. This is about saving kids. So who wants to be responsible for a kid or anybody dying because we didn't do what we could have done? And I'm not going to talk anymore about it. We're going to vote on this, and we're going to make the best decision for our students and staff. So thank you for hearing me.
Okay, thank you all for your comments or concerns. I had quite a few emails as well. I think this afternoon, early afternoon, I just stopped counting them. I read them, but I just stopped counting them because I was losing count anyway. But it was one that really stuck out to me. And I think that came in early this morning, maybe last night. But I know when I woke up this morning, I woke up to it. And it was a parent that had included pictures of her child. And I think she sent an email out to all of the board members. And when I read that email, it made I became very emotional because of the fact this parent actually discussed the birth of this child. And I'm not going to go into too many details. And they started from birth up until today. The parent was afraid that if her child came to school Monday and we voted that the students did not have to wear their masks, that she would have to keep her child at home because of his health. And it was very concerning. This child, because of their unique differences, would not be able to learn at all because that child is not able to do virtual learning because of their differences. It's a challenge for them to do that. So she would just have to keep her child at home, and that child would not get an education. She pretty much said that because the other students are choosing not to wear masks, or their parents are choosing not to wear, or send them to school with masks. And that one stuck out to me. And I know a lot of people are going to say that was just one parent, but I got quite a few emails, and as my colleagues say, it was equal, some for, some against, and they were pretty much equal, the ones we got. But like I said, that one stuck out. And if nothing else, my vote, I'm just gonna have to work with that parent, because we are responsible, this board, we're responsible for the education of every child in Isle of Wight County Schools. And if I vote tonight no to that, then I'm telling that parent and that child, we're not gonna educate you. And I can't do that, because that's the only way that child is gonna be able to get an education. So at this time, if anybody would like to make a motion?
I will. Madam Chair, I would like to make a motion to keep mask mandates in place at all of Wight County Schools as they are now.
Okay.
Second motion.
Well, you've heard a motion and there's a second. I'm going to ask if anyone have any discussion now that we have a motion.
No.
Okay, hearing none, we will take a vote now. I know we had discussion prior to the motion, but I wanted everyone to speak. At this time, I'm following up after the motion, since we have a motion on the floor. At this time, we will take a vote then. I can't see it from here.
Four yeas and a nay.
Okay. Well, the yeas have it. The vote is passed. Isle of Wight County students on Monday, when they return to school, will continue with the policies that we have in place now to wear their masks. And I would like to say this. It is Isle of Wight County Schools' duty to provide and maintain an instructional environment, workplace that is free from known hazards. We are adopting this policy to safeguard the health of our students, staff, and their families, and the community itself at large from COVID-19 viruses. This policy complies with all applicable laws and is based on guidance from Center for Disease Control, which is known as the CDC and Prevention, the Virginia Department of Public Health, the Department of Labor and Industry, the local health department, and all state and local health orders. And this is what we have done tonight. We're going to continue to go forward and have our students to wear masks. At this time, if nothing else.
Before we close out, I'd like to say one thing to the public. You all please be mindful that we're doing this in the best interest of the students. Governor Youngkin does not have one student or kid that goes to Isle of Wight County Schools. He does not have a child in our school system. So please keep that in mind. Thank you.
And also, before we adjourn tonight, I would like to say,
Yeah, if she wants me to.
the bus drivers, our bus drivers have had a hard time through this virus, and especially since we've been back since winter break. And if you're a parent, and if you're going to decide to, if you're going to choose to send your child back to school Monday without this mask, just remember, they will probably not be able to ride the bus because the federal law has not changed. And the federal law is that you cannot ride any public transportation without a mask. So I'm just saying that so we will not challenge our bus drivers, because we're having a hard enough time right now trying to keep bus drivers. So please do not give them a challenge over the mask. If you choose to do that and you don't want your child to wear that mask, then you'll probably have to choose to make sure you get their transportation to school. Thank you. Mr. Collett?
Okay, so we've got a lot of people probably watching at home at this as well. We had a vote tonight. A lot of people aren't going to be happy about it. But folks, please, respect the process, even if you don't agree with it. There are still other avenues. This is probably going to court. So there's still other things that as citizens you can do if you don't agree with it. But please, don't put the burden on the teachers, on the administrators come next week, or the bus drivers. That's one thing I ask. And of course, anybody that wants to reach out to me, please, you know, I'm always available to you, as are the rest of the board members. But please, do not, you know, disrespect the teachers, the administrators, the bus drivers. You know, please move forward with the masks next week. Thank you.
Thank you, Mr. Collett. Any more members? If nothing else to come before, if there is no more business to come before us this evening, at this time, the special